Me speaking.
Good morning, this is Lynette.
Good morning, Lynette.
Good morning.
I can hear you now.
Okay.
But I think a lot of folks maybe need to mute themselves or a lot of background.
Good morning, everyone. We are hopeful that you can now hear us here in the room, but we're having through WebEx some difficulty with our mute and unmute feature. So if you could mute yourself on your end, that would be very helpful. If anyone is able to confirm in the chat box that you're able to hear my voice at this point, that would be helpful. Or if you could just say if you can hear us. Yes. Okay, yay, wonderful.
Yes.
I'm so sorry for the technical difficulties we're having. I think it's related to our ability to mute through the WebEx platform, so we'll try to troubleshoot that on your end. But let me jump into our housekeeping items as we get started today. Again, if you weren't able to hear me before, welcome to the Maternal and Child Health Needs Assessment Stakeholder Group Kickoff webinar. We're delighted to have you here with us today. I do want to provide just a couple housekeeping items before we jump in. Since we're having some difficulty with the mute function in WebEx, if you could mute your phones on your end, that would be super helpful. Thank you for doing that. And just a reminder to please not put your phones on hold. If you do that, we hear the music that your system has for its hold function or announcements, and we can't do anything to fix it. So if you could remember to, yes, put yourself on mute, and no, don't put yourself on hold, that would be super helpful. Also, if you're having any difficulty logging into the webinar itself, you may get a pop-up that invites you to run a temporary application, and that usually will get you into the WebEx platform. If you are having difficulty with that, please, you are most welcome to email Elena O'Mara for help here at MPHI. Her email address is aomara@mphi.org. Also, just one last reminder, you can go to File at the top of your screen and down to Transfer, and that should bring up that same invitation to download a PDF of the webinar and a PDF of just a one-page overview of the Title V Needs Assessment process. And with those quick reminders, I'd love to turn it over to Lynette and Lonnie to welcome everyone here today.
Okay. I think Lonnie and I have just communicated with you that we lost you momentarily, so if folks could probably use that chat box to keep communicating if anything goes awry. Is that the appropriate place to do that, Julia?
That would be wonderful. If for some reason you can't hear anymore, let us know through that chat box, and we will try to troubleshoot it on our end. Thank you.
Okay. Perfect, great. Well, good morning, everyone. This is Lynette Beery. I'm the Director of the Bureau of Family Health Services, which makes me the Michigan's Title V Director or Maternal Child Health Director as well. Lonnie, I'm going to let you introduce yourself in just a moment. I'm just going to say a couple of things and then let Lonnie tell you how his work and my work, how we work together, basically. So we are very appreciative of all your time. We know that all of you are very busy people. That's largely why we want you here, because you're all in your own spheres and in your own community. You are experts and can help enormously as we take a step down the next Title V 5-year application and process and begin to find out what it is that we most need to be focusing on in our work. So Lonnie, with that, do you want to just quickly introduce yourself, and then we can say a few other things?
Sure. Good morning. I hope everyone can hear me. But this is Lonnie Barnett, and I'm the Director for Michigan's Children's Special Healthcare Services Program, which, with regard to federal titles, that has me as the Title V Children and Youth with Special Healthcare Needs Director for Michigan, and I'm very pleased to welcome you all as well. You've all agreed to be a part of an incredibly important initiative for us in Michigan. Children with special health care needs and their families experience challenges that the broader MCH population experiences, but at times the impact may be more acute for children with special health care needs, or there may be unique challenges experienced by these children and their families. CSHS is committed to this assessment process as it will contribute to and in many ways drive our efforts and programming in support of families and children with special health care needs. So with that, I'll turn it back over to Lynette and Julia.
Yep. Okay. Just a couple of more thoughts as we begin this webinar today. The planning group has, with the help of Julia Heaney and her team at MPHI, are very dedicated to the notion that this 5-year needs assessment is being done with a health equity lens. This is a little bit of uncharted territory. HRSA has, the guidance is much broader and does not mention health equity. And when we sat down to begin to think about this, one of the first things that I said, and others jumped right in with support for the notion that we are going to approach this needs assessment with health equity in the forefront. So we'll kind of, through these webinars and our in-person meetings, be, taking a little different approach, looking at the data perhaps a little bit differently. And like I said, we're appreciative of Julia at MPHI and her team to assist us with this. One of the things we may have to spend some time on at some point is what exactly do we all mean by health equity, and how do we do that work in the most efficient and productive way. So with that, I do want to just remind you all that we are required by HRSA in order to receive our MCH dollars from them every 5 years to do a needs assessment. And so that's what we're about to start with, to learn from all of you, again, with that health equity lens, what it is, how it is we can improve the outcomes for all women and children in the state, but most particularly those that are most vulnerable to adverse outcomes. Okay, Julia, take it away.
Thank you, Lonnie and Lynette, for that warm welcome and introduction into the work that we're going to be doing together as a stakeholder group. So as we begin this work and this journey together to understand the most pressing maternal and child health needs in our state, I'd like to invite us all to reflect for a few moments on what's your why. Why do you care about maternal child health so deeply? Why have you committed your work life to the mission of maternal child health? What drives you to be passionate and committed to the health of women, of infants, of children, adolescents, and children and youth with special health care needs in our state? So I'd invite everyone to take a moment to reflect on that. And I would like, if you wouldn't mind, Lonnie and Lynette, to speak to that for a minute. Could you share for us, what's your why?
Sure, this is Lonnie.
Go ahead, Lonnie.
Okay, I'll go first. Thank you. For me, I've worked in the MCH arena for about 8 years, but I worked in public health for the 18 years prior to that, almost 20 years prior to moving into MCH, with a focus on community health planning and healthcare access. And throughout all of those years, that work kept intersecting with MCH. So when the opportunity presented itself for me to move into the MCH arena directly, and in particular to work with children and youth with special health care needs, I really did jump at that opportunity because of the ability that to make a tremendous impact through this work on both people's lives and in the communities in which they live. Thank you.
Thank you, Lonnie. So I have had a passion for MCH work really since I was a teenager. And I have to say, I might not have stated it this way back then, but now my passion really comes from a core belief that I hold, that how a society approaches birth and I'm using that term to mean prenatal to at least 1 year out, and really even before and beyond prenatal to 1 year period. How a society approaches that, how we provide care and support to every single woman, regardless of faith, regardless of color, regardless of gender identity, etc., how we care for and provide support services to all those women and all those infants, who arguably the infants are the most vulnerable folks in our society, members of our society, that really represents a society's core values and ultimately impacts how vibrant and productive the society will be, because after all, those infants are our future. And so that is that's sort of a belief that we must ensure that life is started in the best of circumstances with the greatest opportunity for positive outcomes, not only in health but in other areas of life, is really what drives my desire to do this work at this point.
Thank you both for sharing what grounds you and what your why is for working in maternal child health. We invited a few participants to also share their why out loud on the webinar, and would like to invite all participants to consider typing in the response to the polling question, what's your why? So as we get that started, please type in as you are willing to share what your why is for maternal child health. And in the meantime, I'd love to hear from Amy Zagman with the Michigan Council for Maternal Child Health. What's your why?
Hi, Julia. Hi, everyone.
Hi, Amy.
I think my why is twofold, right? It's a little bit like Lonnie and Lynette, sort of a culmination of my work experience and understand, quite frankly, that there's a lot of populations that are sort of overlooked in the legislative and policy process, and I think that's particularly true of those who may not have the same political acumen, so to speak, with things like political action committees and funding behind them. I think that's particularly true of a lot of public health and population health type activities, including maternal and child health. And quite frankly, just a deep personal connection with the work. So in a way that I think maybe a lot of my colleagues in public policy are not as fulfilled by the work that they do every day, I find this work incredibly fulfilling. And as I look through the list of people who are on the call today, I get the benefit of interacting with so many of you who are incredibly committed to the work that you do. So I feed off your inspiration and obviously take and use your information, hopefully to help with policy and legislation. And so I guess that's my why about, I think it's really important to engage in these conversations collectively with you. And it's why I hopefully get up and come to work every day.
Thank you, Amy, and thank you for being a part of this process. Joanne Hoganson with the Kent County Health Department, are you on the line?
Yes, I am.
Welcome, Joanne. What's your why?
Good morning. Why maternal child health? Two reasons came to my mind very quickly. In terms of long-term impact of all the areas of healthcare, I think maternal child is the most impactful. I have always been dedicated to making a positive change that lasts, and maternal child is the area that gives the most return on investment. Helping babies to be born healthy and get a good start in life changes the entire trajectory of their lives. And then the second reason I approach the subject from a social justice perspective. There's nothing quite as unjust as seeing a baby, through absolutely no fault of his own, experience the consequences of the bad decisions or of a failing system. And so for that reason, I believe the most just thing to do is to provide a maternal child system that maximizes positive health outcomes for babies and children.
Thank you, Joanne, for sharing your why and also for being a part of this process with us. Tag Dahl from MDHHS, are you on the line, and would you be willing to share your why?
Sure. Hi, this is Taggart Dahl from DHHS. and I work in adolescent health. So from my perspective, you know, growing up, I never had access to any kind of teen-friendly services. I never really knew what that was, really until I got out into the workforce. And really in working in adolescent health the past 18 years and having now teens of my own and seeing the access problems that teens are having, and it's not very easy to find services that are targeted towards them. So I think that's, in my position, that's the most rewarding and kind of motivating thing for me, is to provide these services to teens in need. And it's a vulnerable population, and being able to provide those services is very rewarding.
Thank you so much, and thank you for being a part of this process. And, you know, I heard some wonderful themes in what you shared. I heard about social justice. I heard about setting the stage for a healthy life. I heard about creating some equity and leveling the playing field. I heard some real passion and the sense of being fulfilled by the work. And I'm wondering if our poll has echoed some of those themes. Our poll has 15 seconds to go, so we're going to wait in suspense for it to wrap up here. We're almost there. And of course, want to thank those of you who are willing to speak on the line. Thank those of you who are willing to chat in the poll question. And of course, thank all of you for taking a moment to reflect on what's your why as we get started today.
Okay, well, while we
wait for that,
look for the poll results to open, all right, thank you, everyone. So we will move along. Good morning, everyone, and again, thank you for joining. This is Sarah Davis with MDHHS. I'm Michigan's Title V coordinator, and while there are many distinct whys for working in maternal and child health, a common thread is the desire to improve the health and well-being of all mothers, infants, children, and families in Michigan, and also to strengthen the systems that support them. And so before we dive into the agenda, we just wanted to share this slide to share with you a sense of who is in the room, so to speak, today, and who will be engaged in this stakeholder group throughout the year. And I just want to note that in determining membership, Title V leadership and the Needs Assessment Planning Committee really wanted to include broad representation across the 5 population domains that we'll be talking about in a little bit. And just so you know, this stakeholder group is composed of over 60 individuals, and it's really a 50-50 split in terms of internal MDHHS stakeholders as well as external partners. And so you can see in the slide here the many partners who are engaged in this work. And on the left-hand side there, you can see that the Bureau of Family Health Services, which Lynette directs, and the Children's Special Health Care Services Division, which Lonnie is the director of, those are the 2 areas within MDHHS where the majority of Title V activities are housed. Not all, but that's where the majority are, and so just wanted to make note of that as well. And one last thing I wanted to note about the needs assessment as we dive into this content is that, as Lynette and Lonnie both mentioned, one of the requirements for the needs assessment is related to the Title V Maternal and Child Health Block Grant. And we also hope that it is intended to set the stage for partnering in action beyond the block grant. So clearly we will be utilizing this process to inform our next 5-year Title V application, but as partners with us, we also hope that you find the results of this process useful and look for opportunities to build on the conversations, the findings, all of the work that happens throughout this year. And we definitely look forward to meeting with you all in person for 2 needs assessment activities later this spring. And so again, thank you to all of our internal MDHHS partners as well as to all of our external partners. And so our agenda for the rest of our time together this morning during today's webinar, the key items we'll be covering, we'll be providing an overview of Title V and Michigan's needs assessment goals, and then really diving more deeply into specific components and processes related to the needs assessment so that you all have a sense of what the process will look like as it unfolds throughout the year. And then we will identify ways that you will be invited to engage as stakeholders in the needs assessment, and then we will also have time for questions and answers at the end of the process. Okay, so the maternal and child health needs assessment. So before I dive into the needs assessment specifically, I wanted to share a few slides on Title V, either as a refresher for some of you that are familiar with Title V, or if you're not familiar with Title V, as a little bit of background information in terms of how Title V functions in Michigan, and again, to give some context to the needs assessment process from the Title V perspective. So Title V was authorized by the Social Security Act of 1935. Title V awards funds to 59 states and jurisdictions and is administered by the Health Resources and Services Administration, which goes by the acronym HRSA. And a couple requirements related to Title V. So Title V requires that every $4 of federal funding be matched by $3 of state funding. And another significant requirement in Title V legislation is that a minimum of 30% of funds be used for services for children with special health care needs, and also that a minimum of 30% of Title V funds be used for preventive and primary care services for children 1 through 21. And as you can see on this slide, the vision and mission of Title V clearly reflects the commitment and priority to the health and well-being of the MCH population. And on the next slide, you can see that there is a wide array of ways that the Title V Block Grant currently supports MCH work across the state, and really at both the local and state level. So this slide just highlights some of the work, certainly not all of the work, but some of the work supported by Title V in Michigan. So as I previously mentioned, services for children with special health care needs. Also in Michigan, approximately 1/3 of Michigan's Title V funding is distributed to all 45 local health departments. And then some of the other program areas that Title V supports include immunizations, childhood lead poisoning prevention, the perinatal quality collaboratives, safe sleep, reproductive health, oral health, maternal mortality surveillance, and many other initiatives related to services for mothers, infants, as well as systems work, including surveillance and data collection. So again, that's just to give you a sense of really what Title V currently supports in Michigan. And this slide with the pyramid on it is really a graphic that just illustrates the three main buckets, if you will, of Title V services. So you can see direct services, enabling services, and public health services and systems. That latter is what we often think of as infrastructure. And it also illustrates how Title V aligns with those three categories in terms of the 10 MCH essential services. Okay, and so now to move into a conversation more specifically about the MCH needs assessment. And I would just note that, as was mentioned earlier, one of the items in the file pod that is available for your download is a one-page overview of ways to engage in the needs assessment. So just a note that that's there if you would like to download it. So I'm just going to quickly walk through these four kind of overarching steps. So first, and again, as Lynette mentioned, every 5 years, Title V grantees are required to complete a comprehensive statewide maternal and child health needs assessment. And then the results of that needs assessment is used to select state priorities. And priorities are then aligned with federal performance measures as well as state-identified performance measures. And then, lastly, action plans are developed with the intention to improve performance on selected measures and also to address those state priorities that are identified through the process. And so again, I would just note that one of the requirements for Title V, and we'll talk about this a bit later, is that states must select 7 to 10 state priorities. But as you can imagine, through the needs assessment process, typically many more than 7 to 10 priorities emerge. And so the hope is that the overall findings of the needs assessment can again inform Michigan's MCH work beyond the parameters of Title V. And so we just now have another poll question, which Lauren is going to pull up for us. And so the poll question is, have you ever participated in Michigan's MCH needs assessment? All right, thank you. We're just waiting for those results to come in. All right, just another few seconds and we'll go ahead and close the poll to see the results. Okay, so Lauren's going to close the poll. And it looks like about 11 of you have participated in the last MCH state-level needs assessment, and a handful of you have participated in an earlier MCH state-level needs assessment. And we know that there's a handful of you from local health departments who, thank you, participated in a local MCH needs assessment prior. And then a good percentage of you, 18, have not participated and are new to the process. So that's fabulous. And again, welcome. I know that this is the first time that many of us have been involved in the full needs assessment process. I started in this role at the very end of the 2015 needs assessment, and so it's been great to be involved throughout the entire process this time. Okay, and so this slide I just wanted to share with you. Again, as I mentioned, for Title V, HRSA requires states to identify 7 to 10 state priority needs. And so really this slide is just meant to provide context and give you an example of what emerged as Title V priorities from previous needs assessments, just to give you a sense of the types of broad needs that emerged through the last 2 needs assessments. And then on the next slide, to provide some context to the area of Title V focus at the federal level, and this is really identified by HRSA through the transformation of Title V in 2015. As you can see here, there are 15 federally identified national performance measures, or what HRSA calls NPMs, you'll probably hear that acronym, across 5 population domains. So each of these items have been set by HRSA, so the population domains themselves, and then the national performance measures that are listed there. And states are required to minimally choose 1 federally identified NPM per population domain. And the bolded measures in this particular slide represent the NPMs that Michigan is currently focusing on, again, across those 5 population domains. So you can see the well-woman visit, risk-appropriate perinatal care, breastfeeding, safe sleep, adolescent well visit, transition, and preventive dental visits for both women and children. And one thing that I would mention is that these NPMs are linked to longer-term national outcome measures. So those measures include things such as infant mortality, maternal mortality, low birth weight, percent of children vaccinated, et cetera. And so just to let you know that there is sort of a broader framework that probably later in the needs assessment process we will dive into. But again, just so that you can see what the current national performance measures are and really sort of what the focus areas are at the federal level. The next thing I would note is that Michigan also currently has 4 state performance measures, so those are outside the realm of the national performance measures, and Michigan's current state performance measures focus on childhood lead poisoning prevention, immunizations for children 19 through 36 months, HPV immunizations for adolescents, and medical services and treatment for children with special health care needs. And the great thing about the state performance measures is that's the place that really allows for state flexibility in determining our priority areas and our performance measures outside of federal priorities. Okay, and then this is just a quick slide, a table to really provide a sense of how the different components of the last needs assessment sort of came together in terms of the NPMs, the state performance measures, and their alignment with state priority needs across, again, the 5 required population domains. And just one caveat on the Title V side of the needs assessment process is that each priority need must link to an NPM or SPM, and so you can see in that chart the process that Michigan went through to really link those broad priority needs to specific performance measures. And so before we move further into the needs assessment discussion, I would just ask Lonnie or Lynette if you have anything to add related to Title V, and then also if at this point there are any questions from participants.
Sarah, I don't really have anything to add right this moment, but
okay.
I am curious to hear if folks have questions. Great job, by the way, Sarah.
Thank you. And also, of course, feel free to, if you do have questions, to type it into the chat box, and we would be happy to address them through the chat box as well. Okay, so hearing no questions, I will now turn it over to Lynette to discuss Michigan's needs assessment goals.
Sarah, can you hear me?
Yes, we can hear you.
Oh, okay. Are you going to advance the slides?
Yes.
Okay. Okay, there we go. Thank you. Okay, so the primary goal, according to HRSA in the guidance that we received from them about how to approach the Title V block grant, they tell us that the goal of this statewide needs assessment is to improve MCH outcomes and to strengthen state, local, and community partnerships for addressing the needs of the MCH population. Again, as we have said, and you will hear us say many times over, we've kind of inserted into this goal to do this all with a health equity lens. Go ahead and go to the next slide. And so for us, the purpose of this needs assessment is to identify both our strengths around Michigan and our needs of the MCH population, including children with special health care needs, in order to improve all MCH populations' outcomes. We will use multiple types of data, both quantitative and qualitative, regarding health outcomes, health behaviors, health disparities, and hopefully get to some root causes as we take this deeper dive into inequities. We want to strengthen partnerships and our strategies for achieving health equity, kind of goes without saying. And we want to engage a very diverse population and system partners for doing this work and identifying what the strengths and needs are of the MCH population, and ultimately identify state priority needs and performance measures that not only focuses the Title V work for 2020 to 2025, but really helps in a more broader sense to be driving the MCH agenda in the state. Many of you have heard me say many times over that I think we have a lot of work to do to continue down the path of aligning and integrating our work between the private and public sectors, between the folks doing maternal health work and infant health work. And I think this needs assessment process offers us an opportunity to sort of take another step down that path and ensure that what we come out with not only helps us choose the next round of priorities and measurements to attend to what HRSA needs us to do to receive our Title V money, but also more broadly helps us identify how do we best take on inequities, how do we best serve the needs of urban families versus rural families, how do we best serve the needs of adolescents, and so on and so forth. So that's kind of what our goal is with all of this. And we are curious to ask you if your why, from going back to the earlier question about what's your why, if this sort of purpose and these goals align with your passion and your drive, your why for doing this work. So in just one moment, I think the question is up.
Yes, thank you.
Yeah. And again, at any point, if you have questions, folks, do feel free, even about the purpose and the goals here, to type those in or speak up and let us know what you're wondering about. And please answer the poll question.
I think that our poll questions are behaving in a somewhat strange way. We're hearing that a couple people are having some difficulty responding to them, being able to click on them. So we might be having some technical difficulties with our poll questions. But again, just as Lynette just said, please do reflect back to us the extent to which our direction aligns with your intent and purpose and the work that you do for maternal child health, even if we can't get the polls to quite work. But it looks like it's open again, and we are seeing some responses come in now, which is wonderful.
So while folks respond to that, I want to add one more comment, one thing that I did not say that I think is important to think about, I'd like everybody to be thinking about. One of the things that strikes us on the planning committee is that as we think about, this broad group of stakeholders that are needed to inform this work, and as we think about a health equity lens, we are thinking about the possibility that there are people that are what I often call the unusual suspects that need to be brought to the table, people from economic development and housing and transportation sectors, things that are obviously very much involved in social determinants of health and drive inequities, but folks that do work that most of us in public health or clinical health care, that's not our expertise. So as we move forward, we are thinking there's some possibility that we might have to all put our heads together on how to engage some of those stakeholders, or what we would identify as stakeholders in improving inequities.
Thank you, Lynette. And I believe the poll has closed, so hopefully everyone is seeing the alignment between the goals and purpose of the needs assessment and your own personal why. And it looks like we have most participants who responded saying that they agree or strongly agree that the purpose and goals aligns with their why, which is great to hear. And for those of you who are somewhat agreeing or disagreeing, please share with us where you're coming from and how the needs assessment might be framed to fit with the direction you think that this work needs to go. And with that, I'm going to talk a little bit more about the foundations of the needs assessment. And so again, my name is Julia Heaney, and I'm from the Michigan Public Health Institute, and my team here has had the great privilege of being involved for the past 4 years with Michigan's work around the Title V needs assessment. So we provided support around the last round of needs assessment and have been engaged in interim needs assessment activities. Kind of most most substantive piece of that work was perhaps the local MCH needs assessments that happened 2 years ago and will be part of informing what we do moving forward. But it's a great privilege to be involved with such important work and with such a great team of partners, state and local and government and non-government partners, and thinking about what women, infants, children, adolescents, children and youth with special health care needs need in order to make sure everyone has a strong foundation for health across the life course. So I'm going to speak a little bit about what we are looking to guide the process that we are about to engage in, what that work is kind of grounded in. So I'll talk a little bit about the prior state MCH needs assessment, the local maternal child health needs assessment that was completed in fiscal year 18 with local health departments. I'm going to talk a little bit about the needs assessment model that we look to for tools and guidance in MAP. I'm also going to talk a little bit more about how this connects with the Public Health Accreditation Board's guidance for state health assessment and the frameworks that we're using to think about how to ensure that an equity lens is ingrained into all of the work that we do at every stage of the needs assessment process. So as I mentioned, we were invited in supporting the last round of the state's needs assessment, and we learned so much through that process. And as we got started in thinking about what this round would look like, through Lynette's leadership and Lonnie's leadership, we kind of sat down and reflected on what could we learn and how could we enhance what we started before. And as Lynette has shared, a significant piece of that is making sure that we use a health equity and health disparities lens very intentionally throughout every stage of this process. As Lynette mentioned, it's not necessarily part of Title V guidance per se, but it's certainly part of the direction of public health and maternal child health and critical to making improvements in health outcomes for the populations that we serve. We also are very intentional about having a data-driven approach, and when we say data, we mean, of course, the quantitative population level statistics that we all think of, but we also are very committed to ensuring that we hear from community members, from constituents, from consumers about their needs, as well as partners within this work about what they see as needs for the folks that they serve. We're also committed to diverse stakeholder engagement. We are committed to reaching far and wide as we can through this process to making sure that we hear from all of your voices, as well as more broadly the voices of folks that do this work every day, that see need, and folks that are impacted by inequities within our state and our communities. The work that we're doing together is grounded, of course, in the Title V population domains. And those break into these 5 categories: women and maternal health, perinatal infant health, child health, adolescent health, and children and youth with special health care needs. And I think it's important to highlight that because while we're talking about MCH needs broadly, we're also want to make sure that we're very intentionally reaching across each of these population domains to understand what needs look like in a nuanced and specific way if you are thinking about infants, if you're thinking about adolescents, if you're thinking about children and youth with special health care needs, if you're thinking about women prior to or between pregnancies and so forth, where those needs are different and nuanced by population domain. And some of our work will be intentional about doing more in-depth stakeholder engagement around each of those domains, and we'll talk about that more in just a minute. So another piece of what we're grounded in this work is the LMCH needs assessment, or local maternal child health needs assessment, that we completed a year ago or so. That work identified from the local level needs that were emerging from communities across the state. So a small amount of seed funding was granted to each of the 45 local health departments, and all of them accepted that funding, and most of them completed a needs assessment process which identified priority MCH needs for the jurisdiction that they serve. They used a process that's similar to what we'll be using at the state level, and their work resulted in this, what you see on this slide as a diverse group of MCH needs. And we can, I think it's important for us to bring this lens and this work into the state needs assessment process, because I think it helps us see the diversity and range of needs in various communities across our state, and comes from the perspective of local community members and system partners in maternal child health work. So we'll be using this as a ground for learning and building off of in the work that we do together. Another framework that we will be using and referencing through this process is the National Association of City and County Health Officials Needs Assessment Framework that's called MAP, or Mobilizing for Action Through Planning and Partnerships. It's a process that's very familiar to local health departments and state health departments as they do needs assessment work, and is associated with a lot of tools that are helpful in doing a very comprehensive, in-depth needs assessment process. So we'll be using that as a framework for our work together. One of the features of MAP that's especially helpful is that it highlights 4 different types of assessments that are brought into understanding needs and strengths for communities, and I think that they work really well at the state level as well. So the first of those assessments is the health status assessment, which is probably the most accessible and familiar to all of us, where we're looking at population health data, statistics coming from the Behavioral Risk Factor Survey or vital records or so forth, to understand at a population level what health needs exist for our state and for our communities. However, MAP also includes 3 other kind of ways of identifying needs and priorities. So the second is the community themes and strengths assessment, and so we'll look at that at the state level. What are the themes and strengths that emerge from the voices of our system partners, as well as consumers living in our communities that are in need of MCH services or could benefit from MCH services. And so that work for us will involve organizing focus groups, potentially doing some survey work to make sure that we're hearing across those population domains from folks in communities across the state. The third assessment is the public health system assessment, and the intention of that is to look at our system's capacity to deliver those MCH essential services that you saw in one of the earlier slides that Sarah highlighted. So in that assessment, we'll be looking at how well prepared is the MCH system as a whole to do things like surveillance and enforcement and policy development, quality improvement, those really important functions of MCH organizations. That'll be the focus of that assessment. And then the final assessment is the forces of change assessment, which is intended to identify factors that might be have an important impact on maternal child health down the road. So it's kind of the only piece of this that's looking forward instead of looking backward at what has been. We'll be looking forward at what might be in the future, what should we be preparing ourselves for. Another kind of guidepost for the assessment process will be standards and measures for public health agencies in completing assessment and planning activities. And on this slide, I won't read the details of this, but for the Public Health Accreditation Board is the federal entity or national entity that accredits local, state, tribal, and territorial health departments, and they lay out standards for what a health assessment should look like. And so we're keeping that in mind in this process as well. And I think if you dive into the words in this slide, you'll see a lot of things echoed in what Lynette and Lonnie have shared around the importance of stakeholder engagement, being comprehensive in our approach to understanding health needs and priorities, using a systematic approach to gathering and understanding and interpreting data. That's really the sort of emphasis that the Public Health Accreditation Board has to completing health assessment activities, and so we're kind of using that as a reference point as well to ensure that quality is ingrained throughout this process. one of the, I think, most critical enhancements that we're making to this process, kind of in comparison to what we did last time, is being really intentional about thinking about considering what it means to ingrain an equity lens throughout every stage of the assessment process. And so we're looking to a few different frameworks from different states and local entities to help us think about what that means in a very practical and actionable way. And one of those frameworks that we're looking to is up on this slide. So the BAR-HI framework, or the Bay Area Regional Health Inequities Initiative framework, was developed in California in the Bay Area, and it's been used by California hospital systems and health departments as a way to make sure that when they're thinking about community needs, they're thinking about those in a way that's very deeply informed by social determinants of health and inequities that are experienced within their communities and are certainly experienced in our communities as well. So this framework highlights that traditionally in public health, we've been very focused on risk behaviors and biological factors that contribute to disease and injury and mortality, so that our focus has been kind of on the right side of what you see on the slide. And this framework challenges us to think about what it is about the living conditions within communities, institutional inequities, and social inequities that underlie what we see as far as risk behaviors and health outcomes, and challenges us to think about what we might be able to do about some of those things in our work together. So this is one framework that we're looking at to help us consider how to more deeply understand health disparities and use an equity approach. There's also quite a lot of writing happening right now about community health assessment, state health assessment, and hospital-based assessment coming from an equity perspective. So there's been several groups that have kind of looked across community health needs assessments or community health assessments to say, how are people bringing an equity approach into the work that we're doing? And on this slide, you see some ideas that came out of one particular report that I think is echoed in some of the other things that we're seeing and reading as well. So the main point here is that we're trying to look at what other people have learned, experimented with, and tried, and think about how to apply it to what we're doing here in Michigan. So this particular report noted how there are health assessments that are addressing disparities in the context of health equity by engaging the community, emphasizing community voice and experiences to prioritize health needs, engaging community members who are often underrepresented, reviewing indicators and populations that show disparities and using this information to develop targeted strategies, and using the assessment as an opportunity to have conversation about race and health, place and health, and inequities present in the community to further unpack structural and historical barriers to optimal health. So we're thinking about how that applies to Michigan and trying to ingrain some of those ideas in the work that we're doing together. And with that, I'm going to turn it over to Sarah to talk a little bit about the process that we'll be using for the needs assessment.
All right, great. Thank you, Julia. So in the slide in front of you now, this diagram highlights the general cycle that will be employed for this needs assessment process. So I'm going to do just a quick walkthrough of this to familiarize yourself with the process, and then I'll hand it back over to Julia to dive more deeply into each step. So essentially, we're at the beginning, and so planning for the needs assessment started last summer, and the planning committee went through the process of identifying our work plan, what approach we would take, the framework that we would utilize, the purpose and goals of the needs assessment, the process of engaging you, stakeholders, in the process, and then really moving into the second stage, which will be the gathering and interpreting the assessment and capacity data. So again, this will be the piece that both Lynette and Julia spoke to in terms of looking at the quantitative and qualitative data from health assessments, from focus groups, from consumer feedback, and really looking at that information when it's all brought together to move into that next stage of identifying Michigan's MCH needs and strengths. So in this step, it will really be, again, bringing together all of the assessment data, so those different pieces that Julia talked about from the MAP process, to identify strengths and needs. And we'll talk about what this process will look like a little bit later in terms of our plans to bring together an even broader group of stakeholders around the population domains to really do a deep dive into all of the assessment information that we find at the end of this process. And so then after identifying the needs comes the process of selecting the state priorities. And again, from the perspective of Title V, as I had mentioned, we're required to choose 7 to 10. But again, the overall needs assessment findings will be used much more broadly for MCH work, and as Lynette said, to drive our work and to inform our work moving forward. And then the next step of seeking and allocating resources, so whether that's funding or staffing or assessing or strengthening partnerships or forming new partnerships and the many other resources that go into the work that we all do. And then that sixth step, developing goals and objectives for the selected priorities and performance measures, and then developing state action plans, which will include strategies and specific activities related to implementation of the work itself. And as I'm sure you can see, this is not always an exact linear process. Some of these stages will and do overlap. For example, as we've been going through the process of identifying the stakeholder group and bringing you all together, we've also been working with our colleagues in MCH epidemiology to begin looking at and compiling quantitative data in terms of the MCH health assessment. And there's a lot of other stages in this process that I'm sure you can see areas that overlap versus being an exact linear process. And so again, this is just a really sort of big picture look at what the needs assessment process itself will entail. And then the next slide is just to give you a sense of the work plan that's been developed to implement the needs assessment. For each phase of the needs assessment, the planning committee has a very detailed work plan that includes the timeline, the leads, the various components under each of those steps that I just walked through. And this is just an example of the first page of that work plan, which you can see aligns with the Organizing for Success and Engaging Stakeholders for the stakeholder group. And then you can see moves into that second phase of data collection and assessment. So now I will turn it back over to Julia to really share with you more details on each of the steps and for you to have a better sense of engaging in these different steps along the process.
Thank you, Sarah. So the first phase of our process will be organizing for success and engaging stakeholders. And that organizing for success language comes from mobilizing for action through planning and partnerships, an HO model of health assessment. And we like that concept because we know that how you end is reflected in how you start. And we want to be really intentional in making sure that there is space and opportunity for all of our partners to be involved in the process and to have a clear idea of what that will look like. So we'll be highlighting that throughout this piece of the webinar. So what this has looked like for us already is identifying an internal support team and a stakeholder group. So you are all our stakeholder group that are on the line today and that Sarah showed on the earlier slide. And there's an internal support team that's guiding the process, making decisions, led by Lynette and Lonnie, to help make sure that the work is on track, that it's fully supported, and have what we need to be successful. We have talked about how we'll engage the stakeholder group, and I'll talk about that in more detail as we go through. But of course, our first way is by telling you about the needs assessment through this conversation today, and also in the materials that you have that you can download from the webinar and that we'll be sending out later. We want you to share with colleagues that this is happening, and we want to hear your voice as part of the process to make sure that we are as informed as we can be about what needs look like and what the people that you serve are experiencing as gaps in the system and services that are provided for MCH populations. As part of this work, we're inviting cross-sector stakeholders to participate. So leadership was very intentional about making sure that we had balance between state government, MCH staff, and representatives from other sectors as well, to make sure that we have a well-rounded view of what's happening for MCH populations and a well-rounded group to reflect on the data that we see. We, of course, have looked carefully at Title V requirements and are learning about how other states are approaching the needs assessment process, borrowing tools and good ideas from them wherever we can. We've developed a timeline and work plan with action steps, as Sarah showed a snippet of them on the past slide, and we're working on communication materials such as the one-pager that you can download. We've thought through what resources we will need for the needs assessment, as well as how this needs assessment might align with other assessment needs that the state has. And we've developed our statement of purpose and goals, which Lynette shared earlier. In phase 2 of the needs assessment process, this is really what we're stepping into at this point in time, although as Sarah said, these processes are iterative, but we are starting to dive into this work. So we have selected key measures of health status of the MCH population and social determinants of health, including measures that are related to health disparities and health equity. So the fabulous EPI staff and team at the state have done a tremendous amount of work in identifying what measures we should be looking at, and then beginning to pull data for Michigan and Michigan in comparison to U.S., but also looking wherever we can at where disparities might exist. So of course, by data source, what we can look at varies, but we're trying to look at data by race and ethnicity, as well as other indicators where they're available, such as receiving Medicaid as your insurance provider versus having another source of insurance and so forth. So we're trying to be very intentional about not just looking at the high level, but diving into differences between population groups in the way that we look at data. We also are beginning to prepare for our system capacity assessment, thinking about how, along with you, we'll be looking to understand the strengths and gaps of the MCH system in Michigan. We're also in the beginning stages of planning our forces of change assessment, which again will be looking at what we expect to happen down the road, and that's another assessment that will happen in partnership with you. And we are also beginning to plan how we will be gathering stakeholder input, community input, and consumer feedback, thinking through what populations we want to engage in that process, what types of questions we want to ask, and what the steps of that work will look like. In phase 3, so once we gather all of these data from these different sources and different kind of ways of looking at need across the state, what we'll be doing is pulling that together in a kind of comprehensive list of findings by population group. And we will take those findings and present those to population domain groups to help us identify what they mean. So that will be the process of kind of saying, these are our findings, this is what we see in the data, what does that mean to us as far as strengths and needs for the MCH population that we're looking at specifically. So this will be a wonderful opportunity for a even broader group of stakeholders to participate in this work that we're doing together, because we'll be forming groups by population domain to look at the data and identify kind of findings in terms of strengths and needs, and doing that together. Once we have kind of those findings around what the strengths and needs are of the maternal child health population based on data and by population domain, we'll move to the process of selecting priorities. And through that process, we'll be kind of presenting in a comprehensive way all of the findings around need that we saw in the data. And begin ranking those and prioritizing them around particular criteria, which are still under development, but might include things like the implications for health equity, funding, the ability to make an impact within the scope of Title V, whether other resources outside of Title V are available, that sort of thing. And of course, that's just an example of some of the things we might look at as prioritization criteria. But the concept is that we'll be ranking each of those findings against a set of criteria and inviting all of you to be a part of that process. Once this group identifies those priority MCH needs, that will go to the internal group to kind of figure out where Title V can contribute to addressing that need and where other partnerships and other funding sources might contribute to addressing that need. Of course, it is the intention of this and all needs assessment processes really that as needs are identified, partnerships form kind of across the system in figuring out how to address needs. We don't just want to notice that a need exists, we want to collaboratively problem solve and think creatively about all the different funding sources and opportunities we have to address those needs that we observe together. And that really feeds into the next phase of seeking and allocating resources. So in some cases, needs can be addressed through Title V. In some cases, it will be other partnerships and other funding sources that are linked to addressing the needs that we see. For the purposes particularly of Title V, the next step of developing goals and objectives will be linked to looking for happy matches between the national performance measures that HRSA sets out for the Title V block grant and the needs that we identify for our populations in Michigan, and where we don't see a connection between the set of indicators, measures that Title V sets forth. We have, as Sarah mentioned, the freedom to identify state performance measures that give us a target to tell us, are we getting closer to addressing the need that we identified through this process and through our Michigan data. Over time, we'll be reviewing performance measures and trends in those data elements and in those performance measures. And through Title V, we'll be setting some targets related to each of those performance measures that are either selected from the NPMs or developed as a state performance measure. For, again, the purposes of Title V, under the grant, the state develops strategies and action plans associated with each of the priorities and submits that as part of the grant application and reflects on it in the context of a report that happens each year. And it would be our hope that that same kind of idea would be perhaps echoed in other work that is designed to address other priorities of kind of thinking about what can we do, even if Title V isn't supporting it, to address the needs and priorities that we see through the assessment process. So I went through that extremely quickly, and if you feel a little bit uncertain about where we're going, I don't blame you, but needs assessment is one of my favorite things to talk about, so you are more than welcome at any time to catch me or call me or email me to get some more information about where this work is going, and I'd be happy to kind of fill in some of the gaps in what I shared just now, because I know I went through that very fast. But I do want to share with you some of the things that we have thought about as keys to success of this project. We think it's really critical that stakeholders like you and your colleagues are continuously engaged in the process. And we think it's absolutely critical, as Lynette said, to engage those most impacted by the forces that are creating health inequities in this process to make sure that we truly and deeply understand MCH needs within the state. We think it's really critical that we use multiple types of data to tell the story about strengths and needs. We think that the population level data that we have available to us is really interesting and important. And we also know that there's other sides to the story and ways to deepen our understanding of what those data mean. So we're very committed to including both of those types of information in the needs assessment process. We're also very committed to the idea of engaging in this process without predefined ideas about what the needs are. We want to make sure that we're coming into this with an open mind, listening to the data, listening to one another, and reflecting together on what we might not be seeing as far as unmet needs for these population domains and these groups. We're also very committed to the idea of using strategies that reflect the evidence base to address unmet needs, recognizing that the evidence base has gaps and can't tell us always what needs to be done, but we want to use it as a resource to help us think well about what we could be doing to address the unmet needs that we observe through this process. And of course, we want to build on what's already in place. We have a wonderful history of needs assessment among the MCH populations at the state level, at the local level, and wonderful programs and services, many strengths across our system that we want to connect into and build on in addressing the unmet needs that we notice through this process. So in our last couple minutes, we want to talk about stakeholder engagement, which is probably why many of you wanted to join the call today, is to learn about what we were asking of you, why we asked you to be involved, and what that might mean for you. So just to kind of kick that off, I want to talk a little bit about why we're engaging stakeholders. And the first and probably most important reason that we're engaging stakeholders is that we know that without you, we won't understand at the same level, with the same depth, and with the same breadth what needs there are among the MCH populations in the state. Your experience and expertise, your view of the world is critical to making sure that this needs assessment results in outcomes that we can rely on and believe in. So your voice, your perspective is critical to doing this well. We also know that you have access to data and information that we don't have access to. You listen to your consumers. You collect data about the programs and services that you deliver. You have a different view on what data are telling you than at the state level we might have from what the data are telling us. And we want both of those to work hand in hand to make sure that we understand what's going on in an accurate way. We also know that Title V is really broad in its intent and purpose. We're covering 5 population domains that have very diverse needs within and across those domains. And so we want to make sure that we're tapping into the expertise of people who work a lot with moms and babies, who work a lot with children and youth with special health care needs, who work a lot with adolescents, who work a lot with young children and children in middle childhood. All of those populations are critical to the work of Title V, and we want to make sure we hear about needs across those groups. And we need all of you and your colleagues to make sure we understand what that looks like. And we also want to engage you right now in this process because we want to keep working with you after the needs assessment is over and build on the collaborations that already exist and are in place and inform those as best as we can with the results of the needs assessment. So with that, I'm going to turn it over to Sarah to talk through kind of the specific ways and timeline that we're going to ask this group to connect with the Title V needs assessment.
Okay, great. Thank you, Julia. So this illustration highlights some of the key opportunities specifically for stakeholder engagement. So particularly for you and other stakeholders that we will engage throughout the process, it's not an exhaustive picture of all the steps or processes that Julia just walked us through. But again, we just wanted to close by reiterating the touch points that we're asking for your involvement and engagement. So if you look at that slide, the activities that are in blue font in those arrows there are specific to this stakeholder group. So for example, obviously that first arrow there, we're having our kickoff webinar, and then the next 2 pieces are really moving into the system capacity and then the forces of change assessments, which will happen in April and May respectively. Those will be in-person meetings here in Okemos, and so we're really looking forward to bringing all of you together and for us to have some in-person conversations and activities around those 2 particular assessments. The 4th arrow there where it says other data collection, I just want to share a little bit more information, and Julia has touched on some of this in terms of this will really be a deep dive that will span from spring through fall of 2019, depending on when particular MCH groups are meeting or the best opportunities to engage with particular communities or particular community groups. And so this is really the stage when we'll be doing that broad data collection with other stakeholders, so focus groups, a survey, consumer and community feedback, et cetera, as well as looking at opportunities to engage with the Mother-Infant Health and Equity Improvement Plan. So really doing that broad look at all of the qualitative data that we'll be collecting. And then in that next step, in terms of identifying needs, as Julia mentioned, we will be holding population domain groups, and that you all will be invited to those population domain groups. And so you'll be invited to participate in one or more that most align with your work. And as Julia mentioned, we'll include an even broader array of parents, consumers, partners, system partners, et cetera. And that those groups will really be looking, again, at that comprehensive data and all of the assessments to determine by population domain some of the highest priorities here in Michigan. And then after the population domains meet, we plan on additional ways for the stakeholder group to provide feedback on the findings and needs. And then again, as Julia mentioned, the process will move into a smaller team identifying the 7 to 10 Title V priorities and performance measures. But again, to reiterate, the distinction between Title V and that broader MCH work that we are hoping and wanting to do with this group in terms of other opportunities to address needs that are perhaps outside the scope of Title V, but are still very important to MCH work in Michigan. And then the very last piece there is we will, of course, be circling back to you all to have a wrap-up for stakeholders, to share the findings, to share the priorities that were chosen for Title V, and to really continue the conversation around the work that we will be doing together after the needs assessment process ends. And then this last slide is just to share with all of you, as Julia has mentioned and Lynette mentioned, our planning committee. So this is just to share with you the individuals across the department and within MPHI who have been involved in the process since last summer. And then lastly, just to share that next steps will be for this group, the immediate next steps will be the system capacity assessment on April 9th, followed by the forces of change assessment on May 9th. And as we just sort of walked through, there will be additional opportunities to engage in the needs assessment process throughout the year. And so with that, I would open it up to the group and ask if there are any questions or feedback that anyone would like to share at this point. And also Lynette or Monty, any additional feedback? Okay, well, I will take us to the next slide so that if you do have any questions or would like to reach Julia or myself or any of the other presenters that we can connect you with, on that last slide you have my contact information as well as Julia's. Please feel free to call or email us with any questions or additional feedback. We would be happy to talk with you more about this process, answer any questions. And again, we really look forward to working with you through this process this year.
Thank you, everyone. Have a wonderful rest of your day. Stay safe and warm. Bye-bye.